So Leo, I've been back at the hospital now. This is my second day. I had 2 weeks of quarantine after returning from the United States. Both in the US and in New Zealand, I've noticed dramatic changes just over a period of a day in terms of use of masks, social distances. My big question is, how come you seem to be the only person with a mask? And I'm really happy you've encouraged me to use masks. Can you tell me what the salient points are of mask use?
So masks stop droplet transmission. There's plenty of evidence regarding mask use when you cannot keep social distancing. And I have my own theory as well why mask helps. Everybody agree that hand hygiene is important, and also social distancing is very important. Masks help you to improve your hand hygiene. And we all know this disease also transmit through dirty hands, touch your face. When you have a mask on your face, you have an actual layer of protection. So your hands cannot reach your nose directly, you reach your masks. And when you wear a mask for periods, and your self-awareness of hand hygiene improves. Okay, before you touch your face, touch your masks, you know, it's time for me to wash hands. So first, improve hand hygiene. Next is it also improves social distancing. When I wear masks, you have no interest to hug me, and I cannot kiss you. And people wear masks in the general public. They are good citizens. They are following the lockdown rules by the government. They don't go to the beach. And I think there's no fun to have a mask on to enjoy the sun on the beach.
But Leo, you know, I think this is more than just your own theory, because you and I were reading a research article the other day that was talking about Czechoslovakia, the Czech Republic. Said there were 3,000 cases of people with COVID-19, but 24 deaths. And the idea that they had in the article we read, said that there was a fine, a large fine, $800 US, equivalent to an $800 US fine for people who aren't using face masks.
Comparing the neighbor countries, I think the Czech Republic did a very good job. And all countries adopt mask use, like many Asian countries. They did very well, and they basically can keep the disease in a low number, and there's no problem for the health system to cope.
Well, I'm very happy that you've encouraged me to use my mask since back here, and I hope they follow the example of the Czech Republic. Yeah. And thank you for the encouragement.
Yeah. The one more point I'd like to make on the hand washing is in public hospitals, there's an audit team, hand washing audit team. They travel around the hospital to monitor clinicians to wash their hands. The complaint rate is about 50 to 70%. So the clinicians are bad in hand washing. And how can you expect general public wash their hands in this pandemic? So the only way to improve that, wearing a pair of masks.
A simple approach to help us all remember.
Yeah.
And in that study on the wards, they weren't wearing masks. If they were wearing masks, it probably would have been much better. An excellent point.